If I can leave you with anything, I've had to sit in front of my team, my staff, even going back to March when we had our first cases. I donned my protective equipment and I went onto units where COVID was active before I knew much about COVID, its transmittability, and how it would impact myself. But this company really took COVID very seriously as far as making sure that if my line staff had to be up on a unit that had someone with COVID, that if I was going to speak to their safety and the use of equipment and testing, that I and other leadership would also put ourselves in similar situations because we trusted in the process that we were putting forth. Knock on wood, lucky to say that none of us have come down with COVID, that I now really have a deep understanding, having gone through this for months, of the fact that we can significantly impact to almost a point where I would say 99.5 to 99.9% impact on transmission by doing what we've already done, because we have seen this for months, which is using the right gear, washing of our hands, making sure that everybody is following protocol. We have nurses walking around doing this, making sure people are following the protocols. We have our infection control team. We have those 18 members of the ICC that are in different communities, different business lines, making sure that people are following processes and protocols to keep people safe. And we continue to see that COVID can be beaten by using common sense, by using what we know, by using protective gear, by using good sanitation practices, cleaning and hand washing, and that testing is another level in which we can make sure that if there is a case, that case remains a single individual case that can be treated and no one else is put at risk. And we see this over and over again. And I just want to ask families that are considering moving their loved ones in or need a place to rehab after an acute admission to consider us even at this point in time, because I know that your loved ones are safer here than they are many times within within the community or outside of the scope of our buildings. I thank you very much.